Well, hello, everybody. My name is Susan Phillips. I'm your new Governing Board Chair, and I'm delighted to welcome you to the 2024 Annual General Meeting. So let me begin by welcoming members from all over the globe. We currently have 11,000 members from 127 countries, as well as a large number of supporters. For me, here in Melbourne, Australia, it's 8 p.m. And in London, where our staff are hosting the meeting, it's 9 a.m. But I know that for most of you, you're in all sorts of different time zones. Now, while some of our members are attending the meeting in person in London, most of us have the same experience of joining virtually from continents all over the world. So once again, welcome. Just a few housekeeping details. Questions can be submitted using the chat function in Zoom. Please, you can submit a question anytime you want during everyone's presentations. We have a segment towards the end of the meeting where we will actually look at your questions and answer as many as we possibly can within the time allowed. If there are any others, we will follow up with you after the meeting. Another note about subtitles, you can actually use the live transcript function and you can show or hide the subtitles. So one more housekeeping note about voting. As you know, we're voting electronically. If you haven't already, you need to log into your Cochrane account and go to agm.cochrane.org so that you can actually vote in this AGM. Again, you can vote at any time during the meeting, but obviously you need to make sure that you vote before we close the meeting so that we can announce the results. And so we can turn now to the agenda for our AGM. It will take about an hour and a half, and I thank you all for joining and for committing to an hour and a half, I hope. You will see in this slide, I've highlighted 3 items where we will be asking you to vote. So as you can see, they come quite near the beginning of the meeting, and we will close off the votes towards the end so that, as I said, we can share them with you. So without further ado, here's a nice test to your technical expertise. Please, could you approve the minutes of the last annual general meeting, which was held in London in person with some virtual attendance on the 4th of September 2023? The resolution is proposed by myself as chair and seconded by Karen Kelly as treasurer. So please go to agm.cochrane.org to register your vote. Now, while you're doing this, I would like to begin my chair's report. The first thing I'd like to do is to thank Geordie Pardo, who was the interim chair of the board from September 2023 to June 24. Now, Geordie, for those of you who know him, and I know he's known by many, many people because he's been involved with Cochrane for so many years, he brought his usual level of high energy, dedication and passion to this role, and we are immensely grateful for all that he achieved during his time on the board. My appointment as chair began in July, and since that time, I've had a busy induction period, which enabled me to meet every member of the board individually, the co-chairs of the former council, all members of the executive leadership team, and many leaders of Cochrane community groups. I just want to thank everybody for welcoming me, for spending time with me, and for sharing their insights into the Cochrane collaboration. My first board meeting was in Prague in September this year, prior to the Global Evidence Summit. During my time in the board meetings, I had the pleasure of meeting everybody from the board and the executive leadership in person, and I'm delighted to be joining such a high-performing team. So I'd like to report, I've skipped a slide, I beg your pardon. The Global Evidence Summit happened back-to-back with the board meeting. It provided me with further opportunities to meet members of the Cochrane community, and I'm really delighted with all the people who came forward and the people that I was able to introduce myself to. I also met people from the Guidelines International Network, JBI, and the Campbell Collaboration. As you know, those four organizations co-hosted in a way the Global Evidence Summit. We met key partners from the World Health Organization and Global Commission on Evidence, and this was a great opportunity for us to network with people in this whole field of global health. It was my delight to reconnect with colleagues that I've worked with across many different organizations over many years. Cochrane, again, as you know, was the lead collaborator in making the summit happen. And I'm pleased to report the summit was a huge success with over 1,800 people participating from 71 countries. A major outcome from this event was the announcement that we made of a global evidence synthesis collaboration between Cochrane, JBI, and Campbell. And for those of you who follow this development, we're still working on this, and you'll hear more about it from Carla, our editor-in-chief. So turning to the governing board developments, I want to report on a few changes in the membership of the board. As you know, we have elected board members and appointed board members. In relation to elected board members, this year we have 5 elected board members who are coming to the end of their terms, and 3 of these are eligible for re-election. At our Prague meeting, the board agreed to fill 4 positions among elected members in 2024 and 1 carried over into 2025. In relation to appointed board members, this year we had 1 appointed member coming to the end of her term, our treasurer, Karen Kelly, and we thank her for extending her term by an extra year to enable us to fill her position. So the new appointed members include myself as chair and Nigel Jones as our new treasurer, who will begin his role in December. This means that we have up to 2 vacancies among the appointed members, which we can choose to fill in 2025. The reason why we are staggering these elections and appointed members is so that we can actually stagger our board members' terms and ensure much greater continuity in future years. As you can imagine, we don't want everybody coming to the board new and stepping down at the same time. It's not ideal, so we are staggering people's terms. Another priority for us at the board is board diversity. And this is the reason why in the elections this year, we've nominated that at least one of the elected directors will be based in a low and middle income country. This focus has enabled us to attract talented candidates. And for those of you who've checked the candidates, I think you'll agree with me in the election for 2024. I urge you to vote in this election. There is 1 more day to go if you're like me, ahead of everyone else. The voting closes on the 15th of November, Friday. So finally, I would like to thank elected and appointed members who are stepping down at this AGM. And these are, in particular, please join me in thanking Sally Green, Geordie Pardo, and Karen Kelly for their unwavering dedication and commitment to Cochrane during their many years of service on the governing board. We're immensely grateful for all that each of you has achieved and contributed to the Cochrane collaboration at board level, and we wish you well in your future endeavours. So turning now to some of the things that we've achieved as a board in the last 12 months. We actually have some wonderful achievements to share with members. First of all, the governing board approved a new organisational strategy for 2024 to 2027. The strategy has 4 main goals: to produce timely, relevant evidence with and for those who need it most, to save and improve lives by ensuring everyone can contribute to and benefit from trusted evidence, to collaborate locally and globally to strengthen our community and enhance our impact, and finally, to secure our long-term sustainability. To operationalize our strategy, the executive leadership team is responsible for the implementation, and they have been preparing regular progress reports against agreed key performance targets and indicators, which enable us to monitor progress in our implementation efforts. Our new strategy is available on the community website. I urge you to read it because it will guide how the board, the executive team, and our wider Cochrane community make decisions about what we prioritize and how we use our resources to have the most impact. Catherine Spencer, our CEO, will talk more about the 4 goals and outline some of the specific strategies that we're focusing on to achieve those goals. Carla, our editor-in-chief, will talk about our new scientific strategy and other strategies within these goals as well, in relation in particular to the evidence synthesis work. So turning to the next slide, as you know, the board is responsible for overseeing the prudent management of Cochrane resources and ensuring our long-term financial sustainability. And we're pleased that the organization has managed its finances in ways that continue to ensure our viability. Karen Kelly has a longer presentation on this topic, so I won't say anything further. Another achievement for us is the progress that we've made regarding our commitment to open access. Earlier this year, the board approved a roadmap to open access, which places a very strong emphasis on increasing public access using national provisions. These are license agreements that we hold that enable whole countries or regions or states to have public access to the Cochrane Library. We already have licenses in quite a few countries, and we're aiming to achieve much better coverage around the world. And the third aspect of the roadmap is to give greater access to Cochrane review outputs from 2025. And again, I won't steal other people's thunder, but you will hear more about this tonight. The board has agreed that the next Cochrane colloquium will be in India in 2026. This decision is the result of careful planning and discussions with the Cochrane India team. We acknowledge their efforts here, and we look forward to working together to plan this important event. So last but not least, I'm delighted to share the exciting news, which I alluded to before, that we announced at the Global Evidence Summit, namely our formal commitment to the new Global Evidence Synthesis collaboration. This is a very big initiative. You may well have followed that in the media and in seminars that have been hosted by Cochrane to inform the membership. It's funded by the Wellcome Trust and other funders, and Cochrane is playing a significant role in shaping the agenda. Again, you will hear more about this from Carla. So finally, this is the last slide in my report. I would like to conclude by advising you that Cochrane is in a strong position. We have a clear vision of the way forward. We have a strategic plan that will guide both our organizational and scientific decision-making. And we have an implementation framework to support the realization of these goals and plans. And certainly that's something that will be of great importance to the board to monitor. You will see from this final slide that we have many areas of focus in 2025. I won't go through all of these, but the only initiative that I really want to highlight in my closing remarks is our plan to roll out new and improved ways of communicating with members and receiving feedback from members. This is important because it underlines our commitment to being a member-focused organization. So I will now hand over to our treasurer, Karen Kelly.
Hello, everyone. I'm now about to present the financial report for the last year. So I will run through quickly the results from 2023. I'll also provide an outlook for the current year, and I will finish off by saying something about the long-term financial sustainability of the organisation. So firstly, the results for 2023. This is a a summary and also gives you a comparison with last year. You can see here that we have made a surplus of £300,000, and that compares with a surplus of £1 million in the previous year. Clearly quite a big difference. So I just want to highlight, first of all, that the income, you'll see that the income has actually gone up from 8.9 million to 9.7, but expenditure has gone up by more than that, which explains the drop in the surplus. I'll have a look at the income in the next slide, but the increase in the expenditure is really largely due to the extent of investment that we've made in the transformational changes, which are really important in securing the future financial sustainability of the organisation. The other thing to note from this slide is our level of funds, which is sitting at 9.9 million, and I'll explain a wee bit more about that in another slide. So our income levels, we received 9.7 million, and this is a breakdown of the income. And so there's just a few things to highlight here. As you see, by far the largest amount of income that we receive is from the Cochrane Library. So we're very, very reliant on that income. The next line, events income, that was actually the income from the London Colloquium, which was the first one that we'd had for a few years. The other one to note is Cochrane Response. You'll see that has gone down quite a bit now. That they actually had an exceptional year in 2022, so it's probably back to a level that we would expect. And our other income has gone up substantially as well. We benefited from higher bank interest rates, and there's also been increased income from the Man web launch. Our reserves are sitting at a very strong level of £9.9 million, but while that may seem a huge amount of money, I think it's important to understand the breakdown of that. We do hold a free reserves floor of 2.6 million. That's really to make sure that if anything happens, that we have sufficient funds to be able to close the organisation if that happened. Not thinking about that now. The excess free reserves is something which moves up and down according to where we are. And when we come on to look at the outlook, you'll understand why that is important. We have been maintaining a reserve for a few years now for our open access, because we'll be going through a transition period with that, and we just want to make sure we have sufficient funds behind us for that. Restricted funds, that's something which is defined by a donor, very small. And we've also been running for a few years a strategic investment fund, and we have 2.5 million, but we've allocated 0.7 million of that. And spending of that fund is actually, as I said, part of the reason why the expenditure looks so much higher. So looking at our financial outlook for the current year, which we're nearly complete now, so we have quite a clear picture of that. We had budgeted for a deficit actually of £1 million, but it looks as though we'll end the year better than that with a deficit of 0.4 million. And really what we're seeing here, I think, is a reason why healthy reserves are important at the moment, because we haven't actually reached a point yet where we're able to have year-on-year financial sustainability. So let's have a look at that financial sustainability. So first of all, I mentioned that we do have income dependency on the Cochrane Library, so we're seeking to diversify our income. I think it will always remain a large part of our income. We're also looking at the partnership with Wiley as they move with us through to full open access. And Susan mentioned our strategic partnerships, and that will be key to diversifying our income. The central editorial service is core to the organisation, and we're looking to ensure that we have a healthy and sustainable publication pipeline, because that's so important for our revenue. We're also increasing our awareness around cost recovery as a charity, and looking to make sure that we reach a position of full cost recovery for the services we provide. And finally, Susan mentioned that I'll be stepping down as treasurer, so I'm very pleased to be passing on to our new treasurer, Nigel Jones. I'm pleased to pass on an organisation which is in a strong financial position. There's more work to be done to secure our longer term future, and there's an exciting programme of change which seeks to achieve that. And I'd just lastly like to take this opportunity to thank the Central Executive Team, and in particular, Casey Early, our Director of Finance and Corporate Services, and his team for their support to me and the excellent work, and to wish the organisation well. So we now come to the proposed resolution, and the first one is to receive the trustees' report and financial statements for the year ended 31st of December 2023. And we'd ask people to vote now on that. The next resolution is to reappoint Price Bailey as auditor until the conclusion of the Annual General Meeting 2025. And again, I would ask you to vote.
Thank you, Karen. The next person to speak is our Chief Executive Officer, Catherine Spencer.
I'm Catherine Spencer, CEO, and pleased to give you an update from the Central Executive Team. As Sue mentioned earlier, we've had a year of intense consultation with the community and external partners, and the Governing Board signed off our new strategy at the beginning of this year, and it runs until 2027. We believe our ambitious strategy will catalyse a step change in the evidence synthesis community, advance global health equity, and democratise evidence production. We recognise that Cochrane is just one organisation in a fast and complex changing world. We will work collaboratively with people and organisations across the world to make our strategy a reality. Everyone has a role to play to bring about a more evidence-informed world, and we really hope you'll join us on this journey. So Goal 1 focuses on producing timely and relevant evidence. And to do this, we've created a scientific strategy to prioritise evidence that helps those in most need. We've streamlined and simplified evidence production, and we continue to develop new methods to address emerging issues. And we continue to champion research, integrity and transparency. For Goal 2, we focus on getting evidence to the people who need it, and we're making our evidence more globally accessible and usable through our pathways to open access. We're identifying and addressing barriers to equitable participation. We're increasing engagement in low and middle income countries, including our Cochrane mentoring scheme, and we have improved the user interface of the Cochrane Library for equity of access. Goal 3 is to collaborate locally and globally, and to increase collaboration, we'll work with partners at all levels to embed evidence-informed approaches. We're strengthening evidence synthesis capacity in low and middle income countries, and we're facilitating greater collaboration between Cochrane groups, and we'll conduct an engagement exercise and a leaders meeting in 2025. We also support patient and public participation in producing and using evidence. For Goal 4, We are ensuring our long-term sustainability. We have announced how we will deliver public access. We're diversifying our income to enable future ambitions, and we're optimizing our systems and processes, such as improvements to our editorial software and processes. Cochrane has been exploring potential paths to open access. This year, we've made some key decisions about the way forward. We must balance our open access ambitions with our responsibility to run the charity sustainably. A model that made our content free but deprived us of the income to produce or publish high-quality reviews in the first place would be of little benefit to anyone. Our original ambition was to make all Cochrane reviews public access by 2025. If we could identify a financially sustainable path to get there without putting the onus on authors. However, it became clear that this would not be possible in that timescale. While full open access remains our ambition, we have to be realistic about how long this will take. And we're exploring ways to broaden access to our content in the meantime. All Cochrane reviews are free to access after 12 months. All protocols and editorials will be open access from 2025. National provisions paid for by funders in country provide Cochrane Library access to everyone in that region, including patients, health professionals, and policymakers. We are looking to expand public access worldwide through increased national provisions, rather than an inequitable model that would place the cost on authors. Building on this, we aim to unlock content for large regions when a critical mass of countries within the region subscribe via national provisions. Now, a short report on fundraising, communications, advocacy, and Cochrane response. Our fundraising, communications, advocacy, and Cochrane response teams have been really busy throughout the last year. Cochrane helped the WHO launch new guidance on best practice for clinical trials WHA 75.8. We are one of the organising partners for the World Evidence-Based Healthcare Day, reaching over 18 million people in this year's campaign. And we co-hosted the second Global Evidence Summit in Prague with a fantastic 1,832 people attending from 71 countries. And Cochrane presented a session on evidence dissemination, implementation and impact at the funding meeting of EVIR, which is ensuring value in research. Additionally, we've developed donor briefs and engaged key plans for key global health supporters, including institutional donors in the US, Germany, and Japan. We've completed reviews and presented results to 5 WHO guideline development meetings, and we've completed reviews for 4 new commissioners for Cochrane Response. Cochrane has 135 geographic groups in 55 countries. This year, we have application and scoring protocol for establishing a new geographic group, and we have new collaboration agreements which will be signed by geographic groups and Cochrane for a 3-year period. We had a survey earlier this year, and when it was taken, we had 26 languages. But since the survey, we've added Urdu and Modern Standard Arabic. We're in a great place to ensure that Cochrane evidence can be used and accessed by people across the globe. We have a well-functioning monitoring and evaluation platform, which all of those 135 groups are using for 2024. Listed on this slide are the most common activities reported through our monitoring and evaluation platform in 2024. And you'll see the wide range of things that our geographic groups take part in. We're grateful for all of the work of our geographic groups and indeed all of our groups. But I want to say a particular thank you to our translators who are helping us get the Cochrane Library and our evidence into more languages. Our community have met throughout 2024 to increase regional connections. Cochrane Malaysia recently celebrated their 10th anniversary. Our membership is nearly 11,000 people, and our supporters have grown to 147,000 people. We will continue to encourage membership growth. This will be supported by our strategy to strengthen capacity across the world. And we've also updated our membership badges, which we're really pleased to see some of our members are using online. And we have improved the way in which we communicate with members through our membership and supporters newsletters. Our training is delivered via a variety of different ways to support our community. Our most popular channels are our Learning Live webinars, along with the online interactive learning and evidence essentials, which is suitable for both new authors and the public who are interested in understanding evidence and making better informed decisions about health. We're updating 3 Cochrane interactive learning modules. We have a new rapid review Cochrane interactive learning module. We're increasing support for new authors and updating the training supports given to groups. And of course, our geographic groups play a vital role in training the community too. We really value the role that our consumers play at Cochrane to ensure our evidence includes their contribution. Our priorities in this area are improving representation of consumers from lower middle income countries, improving product accessibility, and improving consumer monitoring and evaluation. Our long-awaited Global Evidence Summit hosted over 1,800 people and was a vibrant and productive event. And as the chair mentioned earlier, our colloquium in 2026 will be in India, and more details will follow from Cochrane India. We're working hard with them at the moment to ensure it's a fantastic event. And as I mentioned, we will be having a leadership collaboration meeting. We really recognise the value that our community bring to Cochrane, so more details will be released soon about a leaders meeting in autumn 2025. And with that, thank you to the governing board and also to the central executive team. And I'd like to hand over to my colleague, Dr. Carla Suarez-Weiser.
Thank you all very much. I'm just going to focus on the report in the evidence pipeline. I'll give you some statistics about the Cochrane Library in 2023. Speak a little bit about the new evidence synthesis units and thematic groups, the work that we do that's very important for us on methods and research integrity, our new scientific strategy focusing on the goal 1 of the organization strategy, and the discussions we're having about the community of practice for Cochrane members and the global evidence synthesis collaboration or global evidence synthesis community that Sue Phillips mentioned in the beginning. So our Cochrane Library continued to be very successful. We had in 2023 an impact factor of 8.8 with over 77,000 citations. But farther than that, we are able to have the Cochrane Library full text access for over 180 countries, and 61% of the WHO accredited guidelines mention at least one Cochrane review on there. So these are some of the numbers. When we think about impact nowadays, we're working very closely with our publisher to identify ways of measuring impact that means something for everyone. So we're looking at ways to create stories and follow these stories, especially related to the new scientific strategy. And we have been focused very much on diversify the types of questions that we publish, yet maintaining the high quality and relevance of our reviews. These are only 2 examples. One is about the what influences people, caregivers, parents, to vaccine children. And the other one is part of a very large suite of reviews that we fast-tracked recently to support a guideline from the WHO on postpartum hemorrhagic. And so we work very closely with the WHO. The central team provide the initial support. But the main point that I want to make here is that Cochrane has been, we have over 9,000 systematic reviews, and I think it's very clear to us that the questions that people want from us are different from 10 or 20 years ago, and we have to innovate and be able to use our skills to produce evidence that has an impact. One of the important things for us is that evidence that has an impact globally. So, for example, this year, we published two reviews that have been picked up very widely. One about thermal stability and storage of human insulin, and the other one of water fluoridation for the prevention of dental caries. And here I'm going to stop and thank all the authors and all the community for their work. We provide the support, we provide the secretariat, but this work came from our community and from people that many times volunteer their time to work with us on that. And in addition to the Cochrane Library, we also have, for the third year, our Cochrane Evidence Synthesis and Methods Journal. So we've seen an increase year on year on the number of articles published. This journal follow a publishing process that is much simpler than the Cochrane Library, and the median time to decision, from submission to decision, is been on 46 days, with most articles being published within 2 months. What is really, really very good. And one of the things that the journal is doing now is to partner with other organizations. So, for example, there is a call for papers in collaboration with Campbell and the Environment Organization. But there is also a collaboration with the AHRQ in the United States to publish summary of their systematic reviews. So we're trying to reach to larger audience, but yet streamline and simplify our process. With this in mind, we have launched another call, and the board approved 5 new thematic groups. So last year we told you about the first 7 thematic groups, and this year we've approved another 5 thematic groups, one in acute and emergency care, the other one in functional disability and rehabilitation, maternal, newborn and child health, musculoskeletal health and pain, and planetary health. I really once again want to thank the community for being part of this process and for putting together proposals that we're really very proud of saying these are the way we're going forward. And with that also, we have 5 evidence synthesis units. They are across the globe. So there is one in Australia led by Sally Green, one in Iberoamerica in Spain led by Eva Madrid in Chile, one in India led by Minu Singh and Germany and UK led by Nicole Scholz, and Nigeria led by Mart Merimiku. So these thematic groups and evidence synthesis units, they will join our Cochrane review groups to lead the development of Cochrane evidence synthesis and systematic reviews. And all the reviews developed by the community is submitted to the Central Editorial Service for quality assurance and editorial process. But apart from producing evidence synthesis, part of what our community do and in support to us is develop methods, is being at the front line of method development and the research integrity. So we now have a much more focused format for publication of our reviews, adhering to PRISM standards, and we now maintain regular author satisfaction surveys, and we're pleased to say that 95% of our authors are satisfied on the way we support them in the process. We had developments in terms of methods. For the sake of time, I'm not going to provide all the details, but just to highlight to you the new random effects method that is being implemented, the expansion of the handbook to add rapid reviews, prognosis, and qualitative research handbooks, and guidelines for the inclusion of non-randomized studies. We're also just about to launch a new policy for update. And the past year, we worked on editorial policies for research integrity, management of preprints and retractions, completely new process to complaints, a procedure that is more fair, but also transparent. We created mechanisms to align our data sharing with the principles of fair, and we've been collaborating with other organizations for responsible use of AI in evidence synthesis. Looking forward, as I mentioned, one of the key areas that we've been discussing is how we address global health inequities. And we want to do that to support the deliverable of sustainable development goals and work very closely with our community in low-middle-income countries. So one of the things that we are in the process of working, and as Sue mentioned, we are part of other organizations that put together a global evidence synthesis community. And the idea here is that we get together to understand what is needed in terms of infrastructure for that makes the process of producing and using evidence synthesis more reliable, timely, affordable, but also equitable. And so we have been working very closely with funders, with people that the United Nations organizations that are important for them, the delivery of evidence synthesis to support the Sustainable Development Goals. But we want to hear from everyone. And if you have anything, you can reach out to me. If we maintain regular contacts with the community, and late in this month, we are opening a call for people that want to participate on 5 working groups related to infrastructure of evidence synthesis. Part of what we are doing to support the Sustainable Development Goals is research priorities in our new scientific strategy. So we are focusing 4 areas: maternal, newborn, and child health, multiple chronic conditions, infectious disease and pandemics, climate change, and sustainability. As you know, some of these areas we have a long-term, we've been working on them for long-term, such as maternal, newborn, and child health. Some areas are new to us, like climate health. So we're working with our thematic groups, with our evidence synthesis, and we aim to start putting pilots or develop new areas that can support what we can do in the future. But the focus is we want to produce high priority and timely evidence synthesis, but we also want to diversify the type of evidence synthesis that we produce in these areas with the aim to respond to the needs of our users, but also to be more agile and timely on producing this evidence. Nevertheless, for us, the scientific strategy is very important to maintain the commitments that Cochrane has from the beginning, that is collaborate and involve everyone, innovating methods, champion research integrity, and promote health equity. So we're working very hard with our community to be able to deliver on that. And last but not least, we recognize that there has been so many changes in Cochrane, and with this change, we need better ways to communicate with those producing evidence. So we're working with members of our community to put together a community of practice that will bring together Cochrane review groups, Cochrane thematic groups, evidence synthesis units, but farther than that, all members in geographic group, consumer network that are responsible interest in producing evidence for Cochrane. So this is something that you hear more from us later in the year. And with this, I want to thank everyone. I think we had some challenge years, and we still are facing some of the challenges. The world has changed, and we are really having to adapt to that. But more important than anything is that we are really very keen to have a better process and better way of working closely to you. Thank you very much. I'm now going to pass back to Sue.
Thank you very much, Carla. And we have heard all the main presentations for this annual general meeting. I think you'll all agree that the team and the board, but also the members, have been extremely busy in the last 12 months. A lot of exciting things are happening, a lot of activity, a lot of ways in which members can join and participate in a diverse range of activities. So at this point, we are taking members' questions. And as I explained at the beginning of the meeting, we asked all of you to post your questions in the chat so that we can use this moment to answer anything that you would like to hear more information about. Now, my colleague, Lucy Johnson-Brown, who's our head of governance, is going to let me know what's appeared in the chat. Over to you,
Hello
Lucy.
there. Can you see and hear me?
I can.
So there are a few questions that are on sort of similar themes, so I'll do my best to field them to the relevant person and to group them together. There are a couple of questions about consumers and how we're going to make sure that we ensure consumers or patients are included in our objectives and plans going forward. And I think it's probably best that I ask Catherine Spencer to answer that one.
Yeah, thank you, Lucy. It's a great question. Consumers have been part of Cochrane for a very long time, and we really value their involvement. We have a Cochrane engagement and involvement framework, which was published while Richard Morley was in post and is now being taken forward by April. So within that, we have engagement to ensure that we communicate about health research, evidence dissemination, and that will help more people use evidence in health decision making. It also includes co-production, and which aims to increase the number of reviews prioritised that include consumers in the evidence production process. Accessibility, a programme to improve health literacy among healthcare consumers. Partnerships, which is to establish a range of international strategic partnerships, including patient groups, and evaluation and reporting to establish an observatory in order to ensure Cochrane's work in engagement and involvement is evidence-based. So you can see that there's already a lot of commitment within that consumers engagement framework. And as we move forward with our strategy, our consumers play a really important role in terms of helping us move those 4 goals forward. I think probably the most obvious way that they can support us is in terms of helping us identify questions for reviews, and also playing a part of reviews. And my colleague, Dr. Carla Suarez-Weiser, is currently working on the implementation plan for the scientific strategy, so I expect there'll be more details when that's released as well. I hope that answers them. Questions, Lucy?
Okay, thank you, Catherine. On to another one about the costs of the London colloquium, and a question about what was the net balance, what was the outturn after costs are taken into account. And Karen, is it okay if I ask you to answer that one?
Thank you. I was hoping to bring in Casey because I don't have the detail of that. Casey,
Sure, Casey, could you answer?
Yes.
Sure. Can everyone hear me okay?
Yeah, we
Yeah.
can. Thank you.
Yeah, the London colloquium didn't achieve quite the I mean, it was a very successful event, but it didn't achieve quite the number of delegates that we had originally planned. The deficit was a small deficit of about 150,000 or so. So it did run at a loss, and we do have that challenge with our events in general, because we cannot achieve the sponsorship, the corporate sponsorship that many other organisations do that run events of that scale. So that is always a bit of a limiting factor. I hope that's answered that question.
If I can just add to that, Lucy, I think it's difficult with colloquia. Probably our members realise that they are becoming increasingly expensive, and but we still hear from members how important they are, and we believe that too, that these colloquia are very important opportunities for as many people as possible to come together. So there's a balance that you need to achieve, and if you can't get sponsors, because we certainly have a very strict sponsorship and conflict of interest policy, it's not wrong to run a conference at a deficit so long as you can actually achieve important goals of bringing people together. But that said, we are actually working really hard on the cost issue, and I don't know if Catherine wants to comment on that.
Yeah, thank you, Sue. Yes, just to say, we recognise that the cost of tickets has become more and more expensive over the last few years. And as Casey mentioned, we try to get sponsorship to reduce the cost of the events, but it is challenging because of our conflict of interest policies, which are obviously very important. So one of the things we're wanting to achieve with colloquiums going forward is to bring that cost down. So that's very much an aim. We want to make sure that everybody who wants to attend is able to attend. We're particularly interested in making sure that colleagues from lower middle income countries are able to attend. So those are the goals. We're working with Cochrane India as well, who share those aims to ensure that we have a more equitable approach to it. So yeah, watch this space. We're really trying to look at the model that we use and how we present colloquiums to ensure we still have that really fantastic event, bringing the community and the collaboration together, which is so important, but that it's more affordable.
Thank you, Catherine.
Okay, there are a few questions around the council and the community of practice. And just a bit of a background, after the council was disbanded in September last year, after agreement between the then council and the governing board, a working group was set up to consider new and improved ways of engaging between the large diverse community and the central organisation. That working group met several times during the year and provided some feedback, some recommendations to the governing board that the board considered in September. And I think what the working group and what the board agreed was that a one-size-fits-all doesn't work, and that, engagement should be multi-stranded. So Sue, can I ask you to answer that question, which is how will they differ? And what will replace the council? I think I've probably gone some way in answering that question, but have you got anything to add there?
Yes, it's an issue that was brought to the board in September for my first board meeting. And obviously I've been briefed about the former council and what it did, and the year that's gone by to consider the future of member engagement. Member engagement is really important for us, and we actually now have a well-staffed central team that it has a number of important senior staff members dealing with member engagement. We actually considered the recommendation from the working group about the future of engagement, the framework that was put to us. We really thank the group because the framework was extremely helpful. It included a very wide range of diverse ways of hearing from members and communicating with members. And we agree that there are a lot of different things that can be done. We've handed the responsibility back to the management team to take on board those recommendations and to design a number of innovative ways, and that was part of one of the slides that I presented of engaging with members. And that it has started to happen with the communities of practice, and that was in response to systematic review authors and participants needing a way of talking across the different structures that we now have. And we have other things in the pipeline which we'll reveal in 2025. But rest assured that it's important, we're hearing, we're listening, and we're doing things about it. In terms of, I'm not sure if the question was about the future of the council. Was there a component to the question about that, Lucy?
I think it was just, we said at that time that we would replace it with other or new improved ways of engaging.
Yes.
And the question is, I think, what are those new and improved ways of engaging, which I think we've answered.
Yes, all right, okay. Yeah, so definitely that piece of work has been completed. The working group has done an excellent piece of work there, led by Geordie during his time as interim chair. And we really appreciate those recommendations and thoughts and ideas. And we've definitely taken them on board, and we're working towards more being revealed to the membership as the year 2025 progresses.
Thanks, Sue. There's a question now about geographic groups. It's not necessarily about geographic groups. I think it's about how we share and learn from each other. The question says, it's interesting to see the platform for geographic groups to share their achievements. Are there plans to make this public so that we can learn from each other? Are there plans for something similar for the other Cochrane groups? And Catherine, I think probably you're best placed to answer this one.
Yeah, thank you. Well, firstly, a really big thanks to Tiffany Duke for the work that she did on the monitoring and evaluation platform, and her colleague Carla Dukes-Jack, because that is a great piece of information. We've got a number of initiatives going on throughout 2025, which I think will contribute to sharing information. Firstly, we've got an ecosystem stream of our work next year, which is really looking at the community and understanding how we can collaborate and work with the community. A listening exercise is part of that. So yeah, certainly like to explore how to ensure that we're sharing and learning from people. And that's probably something to bring up with the executives as well. So we can take that back to the various different executives to work on. And we also have a monitoring and evaluation exercise going on in 2025. We recognise that we need to improve the monitoring and evaluation that we're doing at Cochrane. So we will have a project to introduce that and ensure that we have more monitoring and evaluation across the organisation. So there's a lot of work that we'll be doing in 2025. And perhaps whoever's asked that question, please feel free to get in touch with me, because I'd really like to learn more about what you think we should do. We're really willing to listen and understand what the community think.
Thanks, Catherine. A couple of questions about, for you again, Catherine, I think. The leadership meeting that you mentioned, people are pleased to hear that's planned, but just a minor point of clarification. When you said autumn 2025, we mean, of course, northern autumn, don't we? So it'll be late September or late October, is that right?
Yes, my apologies for not taking a global approach to that. I do mean sort of September, October period in 2025.
Thank you. There's a question about open access that Carla, I think I might ask you to answer this one. I'm just going to read it out because I don't entirely understand it, but you'll probably understand it more than me. Will the open access policy suppress the engagement of Cochrane reviewers for additional publication payment of their own work?
One of the things that the open access group has been putting in place is that we know we cannot put the burden on our authors. So we're looking at ways that that's what Catherine was mentioned, that we put a roadmap on. We look at ways to engage with the national subscriptions that will allow people to use to do their review, but is still not putting the burden on the authors. If I understand correctly your question, I think you're saying about who pay. Someone has to pay for the open access, and I think that is the piece of what Catherine was mentioning about needing to have a sustainable process, a sustainable roadmap for open access. We recognize the value of our community and the amount of work that you volunteer and to do for us. And we know very well that that's not the right approach. So we're looking at different ways to find a sustainable journey, but not to put the burden in authors.
Thank you, Carla. And the last question, it's not really a question, it's a really nice comment. And it says 3 cheers for Cochrane for advancing scholarship in research integrity, which promotes safety and clinical guidelines. That's from somebody, Emma, senior editor, who wasn't able to come to the guest in Prague, and looks forward to future Cochrane events, as other people have said, looking forward to that leadership meeting in late September or late October. And that's all the questions, I think, and we want to leave enough time for the awards and prizes.
Lucy, sorry, can I just jump in? I just wanted to add, because you mentioned about people looking forward to other Cochrane events, just to say that the leaders meeting will happen September, October 2025, but our geographic groups and regional groups have a great deal of activity going on throughout the year, as you saw in those previous slides for the activity that has already taken place in 2024. So it's worth connecting with your closest geographic group to see if there are any regional meetings that you can join. Thank you.
Okay, thank you, Catherine. And thank you, Lucy, for organising those questions for us. And thank you, everyone, all the members, for sending your questions in. If you think of another question, just jump on the chat line and we'll look at them after the meeting and let you know the answer, because we value your questions. It's really important that you let us know what you want to hear more about and whether you need more information. Of course, this is an opportunity to hear from us. We are moving on to the next part of the meeting, and so I can formally announce that the voting has now closed. Before I tell you the results, because there will be some number crunching in the background while we do the next presentation. So I'd like to hand over to Vanessa Piecotta, my fellow board member and chair of the Membership and Awards Committee, to announce the awards and prizes. Over to you, Vanessa.
Yes, I'm very happy to take us through the next part, which is to cherish and acknowledge the outstanding people that we're also proud to work with. Starting with our still fairly newly established Lifetime and Emeritus Membership Awards, which are for individuals and leaders of our organization with extraordinary contributions throughout their career and beyond. And this year's Lifetime members are Marty Chaplin and Richard Morley. And our Emeritus memberships go to Teresa Anna Cantisani, Chris Champion, Sibis Fedorovich, Margaret Koster, Chris Mevergames, Anne-Maret Müller, and Nathan Pace. If you want to learn more about their impact, you can read their stories, which will be published on our community website fairly soon. So if you just go to community.cochrane.org, you will very soon can read all about the impact that they had on our organization. Moving on to our annual awards, they're in alphabetical order and always in the honor of a person who contributed extraordinarily to Cochrane. Starting off with the award in honor of Anne Anderson, which is given to a Cochrane contributor who has contributed meaningfully to the promotion of women as leaders and contributors to Cochrane. As per tradition, the award of this year will be announced by the last year's awardees, and we have some recordings for you prepared. So I hope, if I now play it, that you can hear Madeline very well.
Hello, my name is Madeline van Leeuwen, and I am from the Amsterdam University Medical Center, where I lead the Cochrane Gynecology and Fertility Group and the Sexually Transmitted Infections Group. And these are both part of the thematic group Sexual and Reproductive Health. The Anne Anderson Award is presented to a female member of Cochrane who has made an outstanding contribution to promoting and advancing women's participation within the organization. I had the honor of receiving this award last year. This year, I am delighted to announce that the Anne Anderson Award goes to Professor Raquel Bookbinder. Congratulations, Professor Bookbinder. This recognition is well deserved.
Thanks, Madeline. And now I'm
Hello,
hoping that
my
slides move forward, perfect like this. And yes, as Madeline just announced, our proud winner of this year is Rochelle Bookbinder, and we also have a video prepared of her.
My name is Rochelle Bookbinder, and I'm this year's Anne Anderson Award winner. I'm very honoured and humbled to receive this award for my contributions to Cochrane over the last 24 years. During this time, I've published over 100 Cochrane systematic reviews, and I've also mentored and helped many authors. My award, however, is in recognition of the many collaborators that I work with, in particular Peter Tugwell, Lara Maxwell, Geordie Pardo and Elizabeth Gogomu in Canada. And this award is really also for Renee Johnston, who has been my managing editor in Australia for as long as I can remember. And she deserves this award as much as I do. So I'd like to thank the Cochrane Collaboration and Denise O'Connor, who nominated me. Thanks very much.
Thanks, Rochelle. Yeah. Moving on to the prize in honor of Bill Silverman. This prize acknowledges Cochrane's values of criticism with a view to helping to improve its work and thus achieve its aim of helping people to make well-informed decisions about healthcare by providing the best possible evidence on the effects of healthcare interventions. Unfortunately, this prize is not awarded this year, but we want to encourage nominations for next year. Which brings us to the awards in honor of Chris Salachi, which is given to an individual who has made an extraordinary contribution to the work of Cochrane that would not be recognized outside the scope of this prize. And I'm asking now Maria, last year's awardee, or I don't ask her, I already have her recording, but still I will play it for you.
Hello, I'm Mariah Mokwit, the recipient of the 2023 Chris Salachi Prize. The Chris Salachi Prize is one of Cochrane's most prestigious honors. It is named after a Cochrane pioneer who believed in the importance of Cochrane's work, the power of collaboration, and recognizing those working behind the scenes to make it all happen, the glue that holds Cochrane together. It is given to an individual who has made extraordinary contributions to Cochrane that go above and beyond their role. Today, I'm proud to present this year's award to someone who truly exemplifies all these values. Congratulations to Richard Morley.
Thanks so much. And yes, so this year's Chris Salachi Prize winner is Richard Morley, and we also have a video prepared of him.
Hello, my name is Richard Morley, and it was my privilege to be Cochrane's lead for 10 years on consumer engagement and involvement. I'm honoured to accept the Chris Salachi Prize. I'd like to give my profound thanks to the people who nominated me and to the committee for selecting me. I'm deeply indebted to those with whom I shared my journey with Cochrane, members and chairs of the Consumer Network Executive, researchers and individuals in leadership positions who championed involvement, my colleagues in Cochrane, and valued partner organisations. The results of 10 years' work have added up to a significant change in Cochrane's capacity for involvement. The future relevance of its evidence depends on making this a reality. Finally, I want to pay tribute to the consumer volunteers who selflessly give their time, skills and experience for a vision of reliable health evidence, informed choice and better health. It's been an honour to have served you, and I humbly accept this award on your behalf.
Thanks, Richard. And last but not least, the prize in honor of Kenneth Warren, which goes to the principal author of a systematic review published in the Cochrane Library by a national living in a developing country that is judged to be both of high methodological quality and relevant to health problems in developing countries. And our last year's winner, Nishant, will introduce the award and this year's winner.
Hi, I am Nishant Jaiswal, and I was a winner of the Kenneth Warren Prize 2020, and I'm currently chairing the committee for 2024. I'm honored to announce the winner for 2024, Dr. Sean Lee, who won the award for his review on interventions for people with type 2 diabetes mellitus fasting during Ramadan.
Thanks.
Hi,
Which brings us to this year's winner, Sean Lee.
Hi, my name is Sean and I'm truly honored to be this year's Kenneth Warren Prize recipient winner. My Cochrane review focused on how we can support people with diabetes who fast, particularly during the religious observance like Ramadan. Living with diabetes while fasting requires careful management, and our review synthesized the evidence on the most effective strategy to help people fast. This prize really means more than recognition for me, as it represents the hope for millions of people who balance their faith with diabetes management. The award is also a recognition on how we should always use evidence to support guidelines, especially in low-middle income countries where it's most needed. Thank you, Cochrane, for this honor, and to all researchers and patients who contribute to this vital work.
Thanks. Perfect. With this, I don't know whether it's possible, but I would like to invite you all for a big round of applause. So in case reactions are working in Zoom for you, please just give a big round of applause for all our award winners of this year. And with this, I will hand back over to Sue.
Thank you, Vanessa. What an exciting group of talented people. It's a delight for me to see this for the very first time. I'm very, very impressed by people's talents. So let me just go back to sharing my screen. So as I announced before we started the awards and prizes, the voting has closed, but we will now actually see the results of the AGM resolutions, and I will stop sharing so that we can actually see those results popping up on your screens. All right. So thank you for sharing those results. The first resolution was to approve the minutes. We had 89 people who approved them and 20 who abstained, and it would seem nobody voted against, which is reassuring. Also to receive and note the trustees' reports and financial statements for the year that ended 31 December. 98 people received and noted them and supported them. There was one person who voted against and 10 who abstained. And the third resolution was to reappoint Price Bailey as our auditor until the conclusion of the AGM meeting next year in 2025. 95 people supported that, one person didn't, and 13 people abstained. So these are the three resolutions that we voted on. I can, I suppose, confirm that they've all been passed by the majority of people who voted. And I'm delighted that essentially we've come to the end of our AGM. Let me just see if I can go back to my final slide. This is really the last item on the agenda for those of you who've got a nice long memory. We have an item called any other business. Really, that is usually business that people have given us advance notice about. And in this case, there is no other business. And the date of the next AGM, which would normally coincide with our colloquium, but our colloquium is in 2026. So we haven't finalized the date, but we will definitely let members know as soon as a date has been determined, and we'll give everybody advance notice. So the meeting is now formally closed, and we have finished our annual general meeting for 2024. And I thank you for participating and for sharing your questions and for listening to this presentation. And just a reminder, you can contact any one of us at any time if you feel you need more information or you just want to give us some feedback on how we're traveling or issues that are really important to you. You can email myself as phillips@cochrane.org or Catherine Spencer or Carla. And really, we are here to serve the members and hear about your concerns. And we wish you well in the year ahead and look forward to continuing all this good work. Thank you, everyone.